At SafeWork New South Wales, we support the healthcare and social assistance sector to provide safer work, safer care. Our priority is preventing injuries, and we do this by working with businesses to ensure they meet their obligations under work health and safety laws. If you are a service provider or a host employer of subcontractors or agency workers, you have a primary duty of care under the Work Health and Safety Act. This means you must do what is reasonably practicable to ensure the health and safety of workers, including volunteers. A typical workplace might be an office or healthcare facility, but also includes a participant's home if that's where the work is done.
Workers in the disability sector often put the welfare needs of their participants before their own safety, but it should not be this way. While participant safety is important, when it's in conflict with worker safety should be prioritised. If workers get injured, participants would not receive the vital care they need. Designing safe work involves thinking about how work is done, what risks could arise, and putting safeguards in place so that both workers and participants are kept safe at all times. Workers and their employers need to work together to assess and manage risks of violence and aggression, and in some instances redesign the work to be safe.
Any incident where a person is abused, threatened, harassed, or assaulted while undertaking work is considered to be workplace violence. This can include being bitten, spat on, scratched, hit or kicked. If objects are thrown, if a worker is pushed, tripped or grabbed, sexually assaulted or attacked with a weapon of any kind, then workplace violence has occurred. Every such incident should be reported and properly assessed to ensure reasonably practicable risk controls are in place. It is important to remember that not just the physical contact, but harassment or threats of violence can also be considered an act of workplace violence. The risks of workplace violence can arise from factors relating to participants, their carers, the work environment, or the situation and interaction. Situations which expose workers to a risk of workplace violence include providing services to clients with challenging behaviours, performing work alone or in isolated environments, working in an environment where participant family members or friends may be violent.
There are things you can do to manage the risks from workplace violence, such as identifying and managing behavioural expectations when working with participants, and the consequences to services if expectations are not met. Redesigning or changing the layout of the work environment, such as the inclusion of isolation spaces within a home setting or shields between drivers and participants in vehicles. Timely and accurate handover of information between workers and supervisors on shift changes or with client transfers. Ensuring information about the client's home and previous history is considered when developing new support plans. Assessing and eliminating or minimising risks associated with remote or isolated work. Ensuring whenever a risk of violent or aggressive behaviour is identified, a sufficient number of workers and sufficient time is allocated to provide care. Where possible, care during the high-risk period is avoided or provided in a controlled environment. Providing and maintaining good communication between staff and supervisors using appropriate technology. Implementing security measures and controlling access in the workplace. Providing duress alarms and training staff on their use. Providing suitable and adequate training for workers in preventative strategies, responding to an incident, reporting hazards, de-escalation and avoidance strategies, and your organisation's policies and procedures relating to aggressive behaviour. In serious cases, services could be modified or refused until risks from violence or aggression are eliminated or minimised.
SafeWork New South Wales has developed a code of practice on managing psychosocial hazards at work. The code is an important tool for employers and other duty holders as it explains how to comply with the work health and safety laws, including how to identify and manage psychosocial hazards like workplace violence. But besides compliance with legal obligations, there are many other benefits to having safe systems of work to manage psychosocial hazards. These include decreasing the incidence of harm to workers, minimising disruptions to the business as it provides care and essential services, and improving workplace culture, especially if workers feel supported in raising issues or concerns, and can see that positive changes occur to create a safer working environment.
Consultation is a legal requirement and an essential part of health and safety risk management. So make sure you consult with your workers regularly and follow up on any issues that are raised, as well as asking them how risks may be controlled. SafeWork New South Wales has resources and tools available to support you to understand your work health and safety obligations, as well as how to create a healthy and safe workplace. Contact us for assistance on 13 10 50 or visit our website to learn more. Together, we can help you deliver safer work, safer care.